Kyle Winkler here. There's a lot of fear out there relating to the coronavirus. We know that 2 Timothy 1:7 says, God has not given us a spirit of fear. So the fear isn't from God. I actually think it's from a lot of misinformation. So much of my ministry, from my books to my Shut Up Devil app, is all about dispelling lies. As I always teach, the best way to combat a lie is to expose it to truth. Jesus said it, the truth will set you free. One of my best friends and member of my board of directors for Kyle Winkler Ministries happens to be a physician, very notable one too. His name is Dr. Leo Carney, and while I can't use his associations because he's not speaking on behalf of any organization, I can say that he's a published physician in the DC area where he has his ear to the ground as to what some of the talk and thoughts are coming out of our nation's capital. So I asked my friend Dr. Carney if he'd be so kind to join me for a discussion to just explain some of what's happening in terms that we all can understand and to help us Christians know how to react to it all according to our faith. So, Dr. Leo, thanks for hopping on with me here.
No, it's my pleasure. Thank you for having me.
Absolutely. Well, I know that from some of our discussions offline, we've talked about this a lot, but you are in tune with a lot of the research about this virus. But you're also, like a lot of people watching, middle-aged father of 4 young children from high school to elementary. You're a Christian. That's most important, I think. But knowing what you know as a physician, from what you've seen from the research, having a family as a Christian, all of that, are you scared? Or have you run to the store? Have you stocked up? Do you have your yearly supply of toilet paper ready? How are you handling all of this?
Yeah, yeah. I wouldn't. I do have some toilet paper, but
Hopefully.
only the normal amount that we have for a family of six, right? And so, I think the most important thing to realize is this is just another virus, and it's not one of the plagues written about in Revelation. So I don't think we have to worry about that. But I think there are some things that we need to do, and that includes hand washing and good hygiene. And I think we need to follow the lead of our local leaders and our CDC. I don't think we should be fighting against them at this
That's good. And we'll talk a little bit more towards the end of this about more in detail about what we should do, maybe adjusting our lives, how we should react as Christians. But let's get into the science of this right off the bat, because I think there's a lot of misinformation out there about the extent of it and just exactly what it is, where it comes from, what it's doing. I recently read some research, and you tell me if this is true or not, that for at least healthy, young to middle-aged individuals, that there's not really a high chance of getting it, even if you are around somebody that has it. Is that true?
Yeah. Well, so what I can say is that out of the papers that are published from China, there's about a 1 to 5% risk uh, if you come in contact with it to end up getting it. What does that
Yeah.
mean? Anywhere from 1 in 100 to 1 in 20 people that come in contact with it will get it, right? In the United States, our percentages are actually lower, and it looks like people are more on the apt of about a 0.5%. So about 1 in 200 who come in contact with the virus will actually will have significant reaction to the virus.
So if I'm, let's say, at a store, I've got one of the shopping carts where somebody had just sneezed on it that had the virus, and I'm touching it, that's contact.
Sure, sure,
And so what
sure.
that statistic is saying is that about maybe 1 in every 100 to 200 people that touch that shopping cart are actually going to contract the virus from that touch.
Yeah, each contact with the virus is another point on that spectrum.
Okay.
So if you have constant contact with somebody, then each one of those that increases your likelihood of getting that virus. But yes, in general, if you would come in contact with if somebody with the virus came in contact with 200 people, statistically one to 10 people would end up with that virus, just depending. But
Fascinating.
it would be yeah. So it's not the vast majority.
If you're in a household with somebody that is exposed but doesn't know it, that risk goes way up.
Well, it goes up for every contact that you're there. So if you're contacting them constantly, or if you're not washing your hands, or you're not sanitizing things behind them, then of course you have more contact with them. But in general, the general population is fairly low risk. That's why we see in Washington State, we see uh, people in nursing homes getting it,
Right.
because they're in degraded health already, and then you put them in a constant environment of exposure, and so they're more likely to end up with it. So people in nursing homes, people in even in hospitals, right? We sanitize hospitals and things, but the truth is that bad things are found in hospitals.
Sure. Yeah. I'd imagine you got
Bad
a lot of
bad
sick people.
diseases. Mm.
That's kind of where they're housed,
Right,
right?
exactly.
So
Right.
I think that would beg the question for a lot of people who are hearing the stats that you mentioned, and maybe you've heard it on social media and other places, that if the percentage seems to be from our research so far so low, again, for
Mhm.
healthy, young, middle-aged people, we're not talking about the elderly at this point, but for most of America, I would say, if the percentage of actually contacting it seems so low, why are we shutting down everything? Why are we social distancing? Isn't that kind of an extreme reaction to it?
Well, I think the fear that surrounds it is significant. So when you look at it, studies have shown anywhere from 1.4 to 5% will have significant reaction in which they'll actually become critical, right? Or even potentially die. Now, we don't know about everyone that has the common cold symptoms that go along with it. We don't know that. But we know that there are instances where people have had it that really haven't had significant disease from it, probably not significant enough to go to the doctor. And so we would never know that they would test positive for it. For instance, even people with the normal flu, uh, there's about a 14% rate of somebody that has it that doesn't have any significant symptoms. So we know that it exists, but they aren't added into the denominator. They're only added into the numerator if something bad happens.
Okay, so explain that, bring that down just a little bit further. Denominator and numerator. You
Okay.
know, I'm a simple
So
man here,
if you
Leo.
look,
You know
sure.
that. We've been friends for
Okay.
too long. You know that.
So if you put everybody in the denominator who has a confirmed test, right? Uh, but you aren't capturing everybody in the denominator because you aren't testing everybody, and
Sure.
that's not a fault of anybody's. We don't test everybody, even with the flu that kills anywhere from 20,000 to up to 80,000 Americans every single
I saw that
season,
from the
depending on
CDC
how
made
bad
that report. It's average like
right.
50,000 a year or something, 23 to 60 or so
Right. And
thousand.
so significant number of people, but we sort of estimate how many people have the flu because we know some statistics on how often you are to die from certain strands of the flu, and that sort of information. With this virus, the reason why I think there's so much fear with it is because there's a lot of unknown.
Okay.
We don't know a lot of we don't have good population data. We don't know who's been exposed to it in the past. We don't know really the mortality rate because we don't have a good sense of the distribution of symptoms. We know there are people with mild symptoms. We know there are people that don't have any symptoms at all, but we don't know the breakdown of those. We know what we know about the ones we've tested, but not about the ones that aren't sick enough to test.
Because I just saw a report. I know they were initially saying what, up to 3% mortality rate. That means the amount of people that are going to die that contract it,
Sure.
3% of those
Hmm.
people. So three out of
Yes.
every 100.
Hmm.
And then I saw a report where I guess the latest study from the place where this originated, Wuhan, is that how you say it? Um,
Yes.
that
Hmm.
it's now down to like 1.3 or something. So what, it's early is what you're saying now that we don't really have an accurate number.
Yeah, I think that, well, there's question on what you can really believe from other countries, what data, because some countries in the past have been known to skew their data to make things look less infected.
Yeah.
But what
And
we do
China's
know
not that
is
innocent. Well,
we don't know. Right, right, right. But uh, but other countries do it. I mean, we're dealing with it right now. It appears that Russia has only a couple hundred cases. Is that true? We don't know, right? we would suspect that it's higher than that there. But in general, we just don't know a lot about it. We know what they publish. We know certain statistics, but we don't know enough about it to make fears just to uh, help belay people's fears. Uh, it's just the fear that's
The
catching
fear
up
of
right
the
now.
unknown is kind of what
Right.
it boils down to.
Right. I mean, in the past, we haven't seen a huge infection rate. We've seen some people get it that are younger, right? But we haven't seen the mortality rates that we see in the elderly. At one point, they were saying that the average age of mortality in America due to that virus was somewhere in the 80s,
Okay.
like 80. Um, I don't know where it stands now because the numbers continually are changing. But we do have a significant number of people that have the virus, uh, and but we just don't know who had the virus and has minimal symptoms that you would never seek a doctor's care for.
You mentioned kind of likening it to the flu. What would be some symptoms that are different from the flu?
Well, I think that for the average person, they're very similar, right? From what I can find out, the flu virus would be more body aches, but
Okay.
this is definitely more of a respiratory illness. It starts with congestion, moves to
That
respiratory
means like with your
illnesses. It may
lungs,
resemble
like a
right.
pneumonia type of.
So yeah, you would have a cough, and that's what flu is as well. You know, you can get a pneumonia from the flu, or you can get irritation of the lower part of the respiratory system, the lungs, and everything. So it's very much like the flu. Now, I haven't seen reports, and it may just be that I haven't seen them, but the body aches that come with the flu are a little bit different.
Okay.
But the fatigue, the fatigue that comes along with it, the congestion, the cough, all that's very similar. And I think that the way to know the difference is to test for them. Uh, I don't. Before we were only testing people from with certain contacts and things. I think as the availability of the testing becomes more broad based, and we've seen that they've sort of loosened up the testing.
Right.
Uh, but I think that more importantly, it's important that we have a good predictive test. And in the past, even some of those have had high false positive rates, which really isn't helpful.
Let me summarize here with comparing it again to the flu. Is obviously there are some differences because this is not the flu, it's something separate, but largely what's creating the fear surrounding this versus what happens with the flu is simply the fear of the unknown. It's new, it's not tested. Did I hear you correctly? It's not tested as much.
That's what I believe the fear is around. We just don't know. We've seen the flu. We see the flu every year. We we don't think anything of it. We tell people to get flu shots. Some people do, some people don't. Uh, Even though we know that at least 20,000 Americans are going to die every year, and some years it's up to
And
80,000.
millions
So,
contracted every year, like 40 million or something, I
oh
think I
yeah,
read.
yeah, a huge number, and a few 100,000 end up hospitalized. And right now we're somewhere around 40,000 people that have this that we know, right? Because we don't test everybody. And a lot of those estimates are estimates even on the flu, because after a while you stop testing people and just start treating people presumptively because you're now in flu season.
Yeah. I mean, fear, of course, is its own kind of pandemic. It's its own virus that probably is more contagious than anything. I remember when I was
Yeah.
writing my book, Activating the Power of God's Word, and I was looking at some actual studies they did on fear. And I think it was the University of Cincinnati or something did a study where 85% of the things that you're afraid of never actually happen. So we've got a lot of
Yeah.
people that are based on just misinformation, myths probably, that are thinking if you contract it, you're going to die automatically. And you look at, I heard somebody
Right.
say the other day, they were a nurse and they were out on the street just coming out of their job, and they were in some of their um, some of their attire there, and people were looking at them like they were walking death, afraid of, like, get away from me.
Right.
And that's just because of the fears surrounding this. But you mentioned the testing, and I want to get in that because that's a hot topic right now, especially in the media, is, oh, we didn't have enough tests. We haven't been prepared as a country. Explain what's all the hubbub about the tests. And do we have enough? Should we have had enough? What's the deal?
Well, I mean, this is Leo Carney speaking. I think that just like we do for the flu, if you presumptively think somebody has this, then you do the routine things. There's right as of right now, we do not have an FDA approved treatment that we know is studied well that actually helps with this. So whether you have this or you have any other disease that we can't treat directly, right? We treat with something called supportive care. So the testing is great because then we know who we need to take these actions on and who we don't. But the truth is the testing is not helping treatment. Treatment is
Right. You have it whether you're tested for it or not, if you're going to have it.
right.
Doesn't heal
And the
you.
treatment doesn't change whether you have it or not. It's not, yeah, it's it's not going to heal you. It's not a treatment. It's a detection device, which if we have certain criteria and we just treat you as though you have it, I'm not so sure that really impacts things as greatly as we think it does.
So
Now, it does create days lost of work if you're able to work and things like that. But as far as health wise, I'm not so sure it has the impact on health that we think it does.
So Leo Carney speaking again here. I know this is going to be your opinion on this, but would you say then that
Right.
the media has kind of blown this testing thing out of proportion?
Well, I think that I think first of all, I think it's very difficult, and I think it's amazing that within 2 months of an outbreak, we even have a test to detect this specific
Why do you
virus.
say that? Has it been longer in the past for other things?
Well, I think it's definitely been longer in the past, right? And just the fact that we've been able to get people to work together and to develop testing, and it takes time to produce the tests, right? And to produce the reactants and to produce uh, a set protocol to test them. So to do this quickly, it's really somewhat amazing, and to have it at this large of a number, I know everybody and their healthcare clinicians out there that are angry about this as well. But the truth is, this is really unprecedented. The fact that China even could test after a month and knew what the virus was. We're in some pretty incredible scientific times that we even have access to this. But to think that we can produce, billions of these tests by snapping our fingers, we can't.
So you're telling me that the government god can't just go waving its magic wand and create these these tests and masks and everything at will?
Well, you're right. I
I think
mean,
people think that.
regardless of how much, yeah, yeah, yeah. Well, regardless of how much money you have, there's a limited supply of everything in the world. And yeah, we can produce more, but producing more takes time. You can't just produce more overnight. You can produce some more, but you can't produce them in the scope of what we need overnight.
I want to get into your response to it as a Christian, but I just want to kind of give you the floor here. Is there anything else scientifically that we need to know to help us understand this and maybe just to calm people's fears a little bit?
Well, I think part of it is that people keep on saying, "Well, if people just stay inside, this will go away faster," and that's not what we're trying to accomplish with social distancing. Social distancing is for the purpose to limit the number of people at one time who receive the illness, who get the illness, so we don't over whelm our medical facilities. And the reason why that's important is because if we can space it out, maybe we can lower that mortality rate if we have the availability within our medical facilities. But it's not to, in the long run, reduce the number of people who catch it.
Wait a minute here. So you're saying all this isolation that we're doing, social distancing is the buzzword, that's not meant to stop this?
I don't think in reality it will stop this because the virus will be here regardless, right? So
Okay.
we aren't going to come to a place where there are zero cases anywhere that we can now say you can go outside. right? But what we will do is when we start on the downtrend, or and I don't know what the administration or um, the the governors will do, but leadership will eventually decide that the risk is lower because not as many people will need medical care, and they'll say, well, we can let people back out, and we know some people will catch it, but our medical community will not be overwhelmed anymore by
So
this.
that's, I guess, why when you look at President Trump's sign that they always hold up, 15 days to slow the spread. It doesn't say stop the spread when you think about it. It says slow the spread.
No.
And that's just so that our medical communities don't get overwhelmed.
Yes, because if we wanted to get this over with, what we would do is we would have parties like we used to have with chickenpox
Uh-huh.
parties, right? And everybody would get it, and the people that got it, that were elderly or with illness, that some of them would die, and more people would die because we were not spreading out the illness and couldn't take care of them medically. But this will probably prolong the course of people getting it in the United States. But what it will do is it will have the fewest amount of deaths, because our medical community can then have the number of ventilators they need and real sick people they can take care of in their medical facilities.
Am I
So
correct?
I don't want to,
Go ahead. Sorry.
yeah. No, I just don't want people to get the idea that if they stay inside, they'll never get this. The chances are pretty good that a lot of people will get it. It's just, can we take care of it from a medical standpoint so that the fewest amount of people uh, die from this? And I think that's part of that is probably why, if you remember in the early days in China, they set up, I think it was 12 to 14 new hospitals very quickly. And um, I imagine that a lot of the fatalities were due to the fact that they were overwhelmed by the number of cases that came in, not from the fact that the mortality rate is just going.
Because it's such a super virus, but it's because of the lack of care or the overwhelming of the care facilities.
Yeah, I think it's probably due mostly to the overwhelming of the medical facilities, and and we see that with the number of cases in China going down and the facilities being established, that fewer and fewer people, as you said, 1.3 to 1.4 mortality rate now, whereas before it was closer to 3.
And probably as we test and more people have it, you think that number will go down?
I think it will. I think it will if we indeed test asymptomatic. I mean, in order to do this, you'd have to realize that you would have to take a random sample of like 10,000 individuals and see if they tested positive. And if they tested positive, then you would know that if they didn't have any symptoms, that this certain amount of the population has a rate of, you know, whatever, 15, 30, 50%, where they were asymptomatic
That makes
from this
sense. So it's really
virus.
going to be a while before we really have a true sense of what the real mortality rate might be. But if you're saying that most people will get this, but most people are going to survive, I'm assuming that's because, just like with the flu and the various strains that come out every year, that we build some sort of immunity to it. Is that what happens? Simple man here, explain it to me.
Well, sure. And most viruses, we have some immunity to a virus once we catch it. Now, that's also part of the unknown. We don't know how long the immunity to this virus will last, right? Will it last a year? Will it last 2 years? Do we need vaccinations every year? We don't know. And
What
it
is it for the
leads
flu?
into the fear.
Are we, when we have the
Uh,
flu, are we immune from it forever after that?
no, and that's why we have the flu shots, right? So they last for a specific amount of time, and they're always changing the flu vaccine, the types of flu that they're covering in the flu vaccine to give the most coverage. But even with the flu vaccine, I think this year the flu vaccine was about 40% effective, and that's enough for the herd immunity that we're trying to accomplish.
So has God designed our bodies in a way? Obviously, there are exceptions, especially for unhealthy people and compromised immune systems. But has he designed our bodies to deal with things like this?
I believe so. I mean, you look at even the simple example of a cut on your arm. You scar, and it's never quite the same, but
Mm,
you heal from that, and you have a record of that in your body, right? You have the scar,
mm.
and just like this, we have uh, protectant mechanisms called antibodies that are generated when you fight off an infection, and especially from this virus, I think there are antibodies. Now, how long they will circulate in your system, that's still to be determined.
Let's move on now from the science. I think we've covered a lot there that ought to put people at ease. But you're a man of faith. I think most importantly, besides being a noted physician, you are a man of faith. And as I mentioned in the intro, you have four beautiful children I know very well, and from high school on down to elementary. And so, what adjustments have you made in your personal life, you as an individual, and your family life because of this? Have you made any?
Well, I think all of us have made some, right? I think that we need to still know that we have some sort of responsibility to society, and we need to try to preserve human life, and we need to follow laws. We aren't exempt from laws. We need to follow them. So in our state currently, there is a law that you cannot be in public with more than 10 people. Great.
And that's in Virginia because you're in the
Yes.
DC area,
So
right?
right. So we are not allowed to have more than 10 people congregated in public at all. Now, does that mean we still don't uh, commune with other Christians? No, but we limit it to 10 at a time, right?
So you're following the law of the land there.
Right. But I think that, and in my opinion, when you increase isolation and when you're isolating people and you're keeping them from spending time with one another, and actually we're made for relationship, and it's very difficult during this time to have relationships, even right now we're doing this over Zoom,
Right.
right? But it's very difficult to have a relationship when you can't be face to face. It increases rates of depression and isolation, and I imagine out of this, if we aren't careful and this lasts long enough, we'll actually see an increase in suicide attempts and suicide. And that's my opinion. I don't have anything in literature that shows that, but in other circumstances where we isolate people, we have
Yeah,
seen that.
the psychological literature certainly, I think, is
Yeah,
undoubtable. I was speaking on it a couple of weeks ago on one of my webcasts, just about how, I mean, God has created us not to be alone. He created us to be with
right.
people. And there is something that
Absolutely.
happens in our brains whenever we are not just behind a screen, but when we are face to face with somebody. So when we're not, we're out of the
Right.
created order. So something is obviously going to
Absolutely.
have an effect because of that, which I think is why we do see, unfortunately, a rise in
Absolutely.
depression and even worse suicides because of that. So how do you handle that in this period? What are you doing?
Well, I think that if you feel comfortable, I think you should still not cease meeting together, as some are in the habit of doing. Right? I mean,
Mm,
we need to we need to keep our good hygiene. We need to make sure that if we are sick, that we don't infect other people. Now, whether that's good practice, whether it's this virus, whether it's the flu, whether it's a cold, whether whatever it is, if you're sick, stay home. Right? I keep on reminding myself that none of us are so important that work can't handle without us for a couple of days.
that's a good word right there. Yeah. Because I think we do. We have this sense of self importance that, oh, they cannot go on without me. And the
Right.
truth is, they
Well, and I
will.
used to think that. Yeah, I used to think that, and uh, there were many days where I used to brag that I was sicker than my patients, and I probably made them sicker in the long run.
That's a doctor secret. We won't, just between you and I, we won't tell anybody else that.
I can guarantee you that I am not more important. They don't need to see me that day for the most part.
It
So I'd
reminds
rather
me,
keep them healthy and be healthy.
such a good word. It reminds me of the verse I mentioned at the beginning, 2 Timothy 1:7, that we've not been given a spirit of fear, but we have love, we have power, and we have sound mind. So part of love is compassion for other people. If don't go out
Absolutely.
and expose somebody else that might actually have a fatal reaction to it. But the other thing is that
Right.
sound mind word. Some versions put self-discipline. It's just another word for sound judgment or act sensibly. So there's a part that we have
Right.
to play in not being consumed by fear and in helping the general population is to act sensibly about this, right?
Right. Absolutely. And I think it's important for people to know that scientifically, the virus can't just show up in your home, right? So you have to be exposed to it outside your home. You have to bring it into your home. If you're self quarantining, or if if your group is not going anywhere and has never been exposed to it, it can't magically appear in the midst of them and infect everybody. Now, I understand people are going to the grocery stores and some people are still going into work because they have to, and they can't work from home or however that may be. Well, that's a little different situation because the
Sure.
virus can be contracted that way. But when you're talking about in general, we had somebody in our area want to call the police on a group of kids playing basketball. Uh, I think that's fear talking, and I don't condemn those
Sure.
individuals that want to sequester, but I think that there needs to be some sensibility
Hmm.
there because kids playing basketball, if you don't let them play basketball, the psychological damage that we do to these children through this may be longer lasting than the fear from the
So yeah,
virus.
we've got to make sure that the so-called cure for this isn't worse than the actual real effects from the virus itself.
Yeah, I would say that, right? So we're going to have effects, right? We've got senior classes that aren't going to be able to graduate. We've got uh, people that aren't going to be able to do anything their senior years. We've got parents that are upset that they aren't going to be able to go to the preschool graduations. I mean,
Right.
there are all these things, and we need to be looking out for people and reaching out to them. And if that means we do it over Skype or Zoom or FaceTime or whatever, right? Any media we want, great. But if we can safely get together with people um, within the legal limits at
Right.
this point, because there are laws out there, and I'm not saying to break any laws. I'm not. I think we should obey every law unless it goes strict against biblical
Because
teachings,
and that's
right?
it's not doing that at this point.
No,
Right.
it's not, and it's not saying we can't worship God. It's not saying that you have to worship somebody
Right.
else. If that were the case, then I would say that morally I would adhere to God's law.
Right.
But this is not going against anybody's law,
That's
um,
such a crucial
and
point.
I think we need to smartly um, make contact with people, and we need to support them because this is tough for everybody. We just got notified the governor put an all stop on school this year,
Mm.
so kids are not going to be going to
In
school.
Virginia.
Well, in Virginia, well, even homeschoolers get together and
Right.
socialize, right? So, so, and if they attend church, a lot of them attend church and they get socialization there. Keeping them locked in a house will hurt them psychologically in the long run. Let them play outside in your yard, right? Try to play games that are social distancing. No more than 10 people in a
Right.
group, right? But I think we need to do this wisely, and we can't just go on lockdown indefinitely.
Yeah. We need to make reasonable adjustments. Blessed are the flexible, for they shall not be bent out of shape. That's a great modern proverb to go with. Let's not, we're all dealing with things differently. So we just need to be compassionate and we need to be willing to adjust to this time. But tell me some of the spiritual disciplines that you're using right now for your personal life, for your family to stay strong.
Sure, sure. Well, we always pray together in the evenings, so we continue to do that. And I always have a quiet time in the morning, and I usually have coffee. Fasting would be good right
Mm.
now, right? If people want to fast, fasting is a great way to actually hear what the Lord is saying to you. Um, so I think that continuing in the Word and continuing, maybe even group Bible studies online.
I just did one last night. It worked great.
Yeah, yeah, yeah. You can do them that way. I know our kids. the ones that are in the youth group, they have a Zoom call at 3 p.m. every single day, at least Monday through Friday. And then they have a virtual youth group as well. And I think it's very beneficial to them to stay connected
Yeah.
to individuals.
Yeah. I think what will end up happening out of this, not that God caused this, but he uses this stuff to bring about things and get people to move and get people to innovate. Sometimes we don't innovate until
Yeah.
it's absolutely necessary. And I'll be interested to look back at what the church had to do, how we had to innovate because of this. And I think we'll come out stronger because of it.
Yeah. I think from a medical standpoint, for years we've had the ability to do telehealth. And I
Mm,
think that this will potentially push people into comfortability with telehealth.
yeah.
And uh, maybe some of the costs can go down because some of it's done virtually instead of with a brick and mortar facility.
So there are some silver linings to all of this.
Well, I think there, as you know very well, that God uses all things together for good to those who love Him and are called according to His purpose. I think there are benefits to every situation or positives that we can take out of it. And I would just ask your listeners and your viewers, you know, take this time to see what God is saying to you. Don't waste this time and in 2 weeks or a month or however long we're in this situation, not getting closer to your Father, because uh, He may just be saying, slow down
Mm.
and listen to me.
Tell me, who do you trust in this? Who are you looking to? I mean, I know that you're privy to some of the research on this and things, just being a physician, having access to journals and publications, but from a media standpoint, who are you looking to?
Well, I would go to the CDC, right? I think the CDC is probably the premier agency on this, and it's the one that, for most purposes, doesn't have a political leaning, right?
Not
Um,
Republican or Democrat?
and so they aren't supposed to be, and I think they're doing a good job at staying neutral
Okay.
at this point, right? I think they can report the facts without having to put spin on it.
Yeah.
I don't think politics has any uh, place in this.
But it's on steroids right now with an election year, isn't it?
Well, of course it is, because regardless of what side you're on, you're always going to spend the statistics, the data to look the best for your community.
But you're saying the CDC, as far as you're aware, isn't doing that.
No, I don't think so. I mean, and you can look at the statistics. Now, when you look at statistics, um, you have to look at them in comparison, right? You have to know how to read them. So if you look and you say, wow, there are 50 some thousand cases of coronavirus in the United States. Okay, well, please remember that there are 360 million people in the United States. And we
It's good
have
perspective.
around 500 deaths, right? We have 500 deaths. So when you look at it, yes, those 500 deaths are tragic, but
Right.
but it's not a third of the world like it talks about in Revelation. So when we do have something like that,
Mm.
please don't think this is the end of the world, right? This is not one of the bowl judgments. This or a seal judgment. This is a virus. It has not rise to that level. And even if everybody in the United States got it, yes, a lot of people would die, but it still would not be a third of the population.
Right, right. Obviously, you can't tell the future, but based on history, we've been through things like this before in human history, right?
Right.
Is there something that you can kind of gauge for how long this thing might last, as far as in this kind of hyper sensationalized sense?
Sure. The honest truth is, it's hard to say, because although we tried some stuff, some control measures, even during the Spanish flu in 1918, we didn't have the communication ability that we have now.
Yeah.
And I think that now that the communication is out there, we haven't seen, social distancing to the maximum like we could now because of communication
Yeah.
and messaging. So I honestly would say it depends on how long the fear lasts. It's not how long the virus lasts, it's how long the
Mm,
fear lasts. And I think it's possible. Hopefully, the fear will die down soon. Knowing how people react to things, it may be a while. It may be a while because when we look at when will we have a vaccine, when will we have uh, good studies. I know there are promising medications, at least anecdotally, that are coming out. If we could get one of those, I think that would help re, uh, reduce fear in people, and then we could start going about life at the new normal.
it's fascinating that you say that it all really depends on how long the fear lasts. So, really, we Christians, we've been given the Holy Spirit, and the Bible says that we have not received the Holy Spirit to be slaves again to fear. We have the ultimate hope, the ultimate joy. So, we Christians really
Right?
could be the cure for the fear and help
Yeah,
shorten this.
I think when you are certain of your salvation and you know where you're going, yeah, do you want to die? No, I would like to see my children grow
Yeah,
up, right? I want to see them grow up. I want to give my daughter away. But the fear of dying is not paralyzing to me.
right.
If I die, I'm with Christ, right? So just as Paul said, to live to live is Christ, to die is gain. I actually receive a better reward by dying than I do by living. Doesn't mean I want to kill myself. I don't. I promise you, I'm not suicidal. And it doesn't mean I necessarily want the virus and I don't want to spread it to anybody else and I don't want my family to get it. But I'm not afraid. I'm not afraid. If I get it, I get it. I think that's an important distinction that Christians ought to make. Yes, if you get it, you get it, but don't be fearful, because fear does not help anything. Worry does not help anything. Jesus talked about it in the Sermon on the
Yeah.
Mount when he talked about worry. He said that you can't even grow yourself an inch by worrying. Well, if I can't grow myself an inch, I can't do anything about this by worrying, because this is a lot more difficult than an inch of growth.
So that's really a word, Christians. We could be the antidote to this fear thing. Put your faith in God. Know that He is in control of your destiny. Leo, you get the final word. Give us something to think on from here to close us out.
Well, I'll go back to the prior thing I said. Take this time, think about what God is trying to teach all of us through this, and specifically think on what God wants you to learn from this circumstance. Don't waste this time, it's too precious.
All right. Thank you for watching. I pray this truth has helped to dispel some fear in your life. If you need more help standing on God's promises, check out my free mobile app, Shut Up Devil. It just gives you God's word coupled with personalized declarations for all kinds of feelings and fears that we all face. Search Shut Up Devil in your app store. It'll help you stay strong, especially at a time like this. God bless everybody.